I'm Dr. Thaddeus John Bell, and today we are talking to Dr. Valarian Bruce, who will be graduating from the Medical University in about 3 weeks. Welcome to Closing the Gap in Healthcare.
Thank you.
The reason that we are talking to Dr. Bruce is because he has done something that I think is very exciting, and certainly he's to be congratulated because he's getting his second degree from the Medical University. He already has one in physical therapy, and now he's about to get an MD degree. I thought it would be very interesting for students who want to pursue a medical education to hear from Dr. Bruce's perspective of what it takes to be very successful at MUSC. So Dr. Bruce, you're on.
Thanks, Dr. Bell. First, I would like to say thanks to Dr. Bell for having me here. And I am a native of Cross, South Carolina, right here in the Low Country, so this is my home. I think it's important for students who want to be successful, not only in the health field, to have certain characteristics and certain traits that will help them elevate themselves and do well. I was able to identify several key points that I want to point out today. The first is a student must have a very good and strong academic background, meaning A's and B's. Now, we all aren't A and B students, but I think if people are able to apply themselves and work hard, then they can have success in the classroom. A strong desire to learn can sometimes overcome difficulties with test taking and difficulties with gaining and understanding certain information. So a strong academic background is very important. Second of all, students need to do their homework. And when I say do their homework, I mean find information out about the schools that you're interested in and the programs that you're interested in. Different programs have different requirements. They have different deadlines for applications, and it's important to understand what these programs might require in order to get admissions. And in thinking about admissions, you would want to talk with an admissions coordinator of the school. The admissions coordinator's job is to work with students to tell them where they are in their academic career, to give them a good understanding of what it would take to become a student at the school and what it would also take to be successful. This also gives you the opportunity to ask any questions as it pertains to what you've done to that point and what you may need to continue doing.
What personal barriers did you experience as you were matriculating through the College of Allied Health Profession as well as the College of Medicine? What personal barriers, Dr. Bruce, did you have to overcome?
Initially going to physical therapy school in the College of Health Professions, which I went immediately after college, finances, I would say, would be one of my biggest barriers. I didn't come from a very privileged family, and I was able to go through my undergraduate education on full scholarship.
Where did you go undergrad, by the way?
To the College of Charleston.
Okay, very good.
Although there are lots of scholarships and grants available to undergraduates, those financial assistance aren't always offered to graduate students. So students need to understand that they may have to take out financial aid in order to fund their graduate education. Also, I found being a minority a minor challenge in that there aren't many African Americans at the Medical University of South Carolina. Fortunately for me, I went to the College of Charleston where I was already a minority, and over the 4 years I had gotten accustomed to being a minority in the classroom. Right. But you will see very few African Americans, either students or educators, at the Medical University of South Carolina.
Did you think it was a good experience?
I thought it was a great experience. I think the educators and tutors and mentors at the Medical University were very welcoming and willing to be there for me as I needed them to be.
Right. One final question, we're about to run out of time. Where do you go from here? What are your plans, and where is your career taking you next?
I have matched.
And what does that mean?
Match means I will be starting a residency at McLeod Regional Medical Center in Florence, South Carolina this summer, and I'll be there for 3 years studying family medicine. My future plans are to work in an underserved area and doing a lot of things like you yourself are doing with closing the gap in healthcare. My desire is to go back to the rural, underserved communities of South Carolina, mostly in the low country area, to try to improve the health of African Americans and underserved populations.
Well, thank you very much. I'm Dr. Thaddeus Bell, and this is
Dr. Valarian Bruce.
And we're closing the gap in healthcare.